Tuesday, November 10th, the aches and pains had slightly subsided, but I still had a fever and no appetite. By early evening, I dressed and went to the walk-in clinic to get tested for COVID-19. And that night and for the next 3 days, I slept, didn't eat or drink, ran a fever, which at one point reached 102, and developed a dry cough. On Friday, November 13th, the COVID-19 test result came back positive. And after suffering for another 6 days with the aches and pains that was subsiding, the fever that wouldn't go away, and the inability to eat or drink, and the constant cough, which I was most concerned with because of my history with asthma, I decided to go to the hospital to get examined. On Thursday, November 19th, I entered the emergency room thinking I was going to get a breathing treatment and return home. After taking my vitals, they immediately told me I would be getting admitted. I spent the next 12 plus hours isolated in a room behind a curtain that separated me from all the other ill and injured patients who lined the halls of the emergency room due to the other isolated COVID-19 patients occupying the other rooms. IV fluids were connected, blood was drawn, and a plastic urine bottle and commode were made available because I, along with all the other COVID-19 patients, were not allowed to use the hospital restrooms. While making my way to the CAT scan area, I became nauseous and attempted to vomit, but I had no contents in my stomach. And when I returned back to my isolated room, I was told that the CAT scan revealed that I had COVID pneumonia. When the next room was available, I was brought up to the 4th floor where all the COVID-19 patients were attended to. I spent the next 4 days in isolation where the doors were to remain closed for the safety of all the patients and staff. And every person who entered the room donned protective clothing and removed it before exiting the room. During my stay, I found it difficult to eat the hospital meals because everything tasted and smelled like chemicals. I mostly slept and received the IV fluids, antibiotics, Tylenols, cough medicine, and inhalers.